Hi everyone, this is Tara from the Med Team. I thought I'd bring you a new series of videos, something I was thinking about over the last couple of weeks or so that might answer some questions for you. Things that are common, things that we get a lot of questions about, things I'm seeing with clients on a daily basis or a weekly basis. And so I wanted to start the series with GERD, gastroesophageal reflux disease, and that compared to functional dyspepsia, which in relation to Gulf War syndrome that we see a lot of. You can also leave comments under this video. We will try to gather all of them up and try to see what's a common pattern, what are some common questions that a lot of you have that we can touch upon and dig a little deeper into. There are very common conditions that a lot of y'all have and have a lot of questions about. And as well, clients that I've seen where I'm going through their records and their files and I see these previous denials and they came out claiming Gulf War syndrome for every condition that they have, when we discussed there are definitely some very specific conditions, but this is one that is very confusing. And it's confusing even for us providers and to deal with, because there's overlap of symptoms and there's a little bit of confusion of exactly how to diagnose one versus the other. So I'm going to try to dig a little deeper here and clarify that for you, because that might give you a little bit of tools. One, to know, is GERD your true diagnosis? Do you need to go back to your doctor and say, hey, this doesn't sound like me, how about this? And have that education and understand what we're talking about when we can actually successfully do a Gulf War claim relating to gastrointestinal disorders, specifically the upper area. Basically, let's talk about what is the definition of functional dyspepsia. So functional dyspepsia, there's signs and symptoms without structural or chemical alteration. These need to be chronic conditions that are not diagnosed or not attributed to any other diagnosis. But really, what does that mean? And that's what we're going to get into here. So signs and symptoms, that was one big thing. You don't have a clear diagnosis. Functional dyspepsia is a diagnosis, but it's really signs and symptoms. So if your doctor somehow diagnoses you with epigastric, or which is upper abdominal pain, that could be it. Not chronic nausea. You can have just the symptom as your actual diagnosis, or they can actually go along with the functional dyspepsia diagnosis. So what is GERD? GERD is mostly a clinical diagnosis, which a lot of people have, and its symptoms, they are very similar to functional dyspepsia, but there's symptoms plus mucosal damage or chemical damage. It's basically where acid reflux goes from the stomach through the sphincter, that little tight area that sort of keeps everything in the stomach. When that loosens up, or if there's a dysfunction there, acid will come up into the esophagus or into the airway, into the neck. And so that is truly the definition of GERD, is that you have these symptoms, but you also have this functional or this structural problem with the sphincter where the stomach contents are coming up. That is not the case with functional dyspepsia. And so we're going to get into a little bit of the differences there. So the confusing part is that there are, like I said, overlapping symptoms. And the American College of Gastroenterology actually recognizes the definition of functional dyspepsia as any symptom in the upper abdomen area, which could be the exact same symptoms as GERD. So this is where we all get very confused, and how clinicians can get confused on this as well. They developed this criteria called the Rome criteria, and they're on their fourth evaluation of their fourth round of updating these criteria right now for this. And so per this criteria, for you to meet this, you need to have symptoms at least once a week for 3 months, the onset of symptoms for 6 months. So basically 6 months of symptoms, at least once a week for the last 3 months, which most of you do who have these conditions. The common symptoms with functional dyspepsia that GERD doesn't have is the upper abdominal pain, fullness, bloating, feeling like you're full really early, but nothing else. So that's the kind of difference that I'm noticing. That basically when you have GERD, a lot of people were describing, I have acid reflux, I feel it coming up, I get nausea, I do have some of this abdominal pain and burning, but definitely with functional dyspepsia, sometimes you're just getting that fullness. You're just getting that uncomfortable sensation. You're just getting that, wow, I ate like 3 bites and I'm completely full. But it's difficult because the American College of Gastroenterology recognizes all symptoms as possibilities. So that's where the confusion comes. But the official criteria say it's pretty much that upper abdomen sensation, as well as no evidence of any other testing that's positive. So what that means is that you would be seeing a gastroenterologist. You would be getting a scope, an endoscopy, EGD, that's what they're called, or they go ahead and take a look in the stomach and they don't see anything wrong, completely normal. That is a criteria for functional dyspepsia. It also could be that you have something called NERD, or non-esophageal reflux disease, where there's not erosiveness, but the symptoms are where we can clearly distinguish between the two. So we're looking at a normal scope as well as pH testing. That's the gold standard. pH testing. So when you have acid refluxing up into the esophagus, that's going to change the pH because the pH is going to be more acidic. And so if they're doing you justice with this, they're going to check the pH as well. So they're going to get the scope, they're going to get the pH to make sure that you don't have acid refluxing up. You're going to test negative for something called H. pylori, which is a bacteria that can cause some of these symptoms. And you're going to have the symptoms mostly of just that fullness. That's more a functional dyspepsia. So I'm hoping that that clears things up a little bit, but yet with the overlap of some symptoms, because people can experience nausea, can experience some of the same burning and sensations of reflux, but it's really, you have to be seen by, according to this Rome criteria, by a gastroenterologist and have that procedure done, as well as pH testing, in order to really get someone who's going to diagnose you with that functional dyspepsia. Now, I'm not saying your primary isn't going to do that at some point, but I would say that they would be hesitant to diagnose you with functional dyspepsia unless you have clear symptoms. I just have the abdominal fullness and you don't have acid reflux and you don't have the typical other symptoms. So you can ask them about it, but there's really not a lot that they're going to be able to do outside of getting that gastroenterology evaluation in order for you to say, I meet this Rome criteria. Can you please change my diagnosis that this is more of a functional problem, not a structural problem. It doesn't meet criteria for GERD, and this is what I'm doing. And so sometimes talking to your doctors and explaining your rationale on this, especially if you're close from leaving service and you're trying to get this through a Gulf War syndrome, that would be my best recommendation, is trying to figure out, do you have functional or do you have structural issues with your stomach? So I'm hoping this clears things up a little bit, or at least gives you a little bit more information as to what we're looking for and why we keep saying we cannot do GERD secondary to Gulf War syndrome. It's because it's structural, because that anatomy is the problem. That sphincter is letting acid through, whereas the functional, it's just some symptoms, and we don't know why you have the symptoms. And there's been a lot of research, but the American College of Gastroenterology, they also don't know why this is happening. They don't know why you would have those symptoms, but there's a lot of studies on it, and it's just a matter of getting you the right diagnosis and getting you the right claim going. Now, with all that said, do I think you need to, if you've served in Gulf War, do you need to jump through all those hoops? No. We have plenty of ways to connect GERD. We have plenty of ways to connect your upper abdominal pain and all those symptoms to your service through NSAID use, through other mechanisms as well. So it may not necessarily be something you need to chase down. I just really wanted you to know the difference between the two, that what does functional really mean? What does structural really mean? And the fact that they don't even have a clear understanding of it through the specialist and through what they put out as their standard of practice through the American College of Gastroenterology. So it can be confusing, but if you're heading down that path and you're dead set on that path of Gulf War syndrome, that's what you need to have. You need to meet that Rome 4 criteria, have that negative scope, have minimal symptoms, have no evidence of pH change in order for the VA to grant that for you. Short of that, we would be better off going the route of GERD secondary to something else that you've got going on in your case. So that'll be it for today. I will be back again soon with another topic. You can leave some comments down at the bottom of this video, and we'll try to gather up some information on some interesting topics that you'd like us to talk about. I'm open to just about anything. If there's something that you're confused about, something that you'd like more information about, or anything that you'd like the med team to sort of dig a little deeper into, hit us up. All right, y'all have a great afternoon. Thanks for watching.